Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue Shoal Therapy, Part 27, KALI PHOS 3. KALI PHOS for back and extremities. Idiopathic softening of spinal cord with slow molecular deadening of nerve centers. You try to realize the meaning of this particular line. Idiopathic softening of spinal. Idiopathic means causeless. Softening of spinal cord. The spinal cord is getting softened, that is, it is degenerated. With molecular deadening of nerve center, the nerve center are dying. Rheumatic pain like lameness, stiffness, worse from rest, much movement in the morning when rising up from sitting position, but better gentle motion. Neuralgic pain with numbness, worse from exertion, fatigue, from tingling, itching in chilblains. Chilblains means frostbite. This is chilblain, frostbite. Attacked by cold, sometimes the skin gets gangrenous. Use internally, externally. Mind it, in tissue shoal therapy, wherever possible, you can use the same medicine internally and externally. Internally through mouth, externally on the skin. In case of, say, injury, frostbite, in case of rheumatic pain, in case of burns, scald, everything you can use internally, externally, and then the cure will come faster. KALI PHOS for respiratory symptoms: hoarseness due to excessive use of larynx, complete loss of voice for paralysis of larynx. Famous Dr. Carey suggested big doses of KP for breathing troubles of very weak and depressed asthma patient. See, asthma, in case of asthma patient, the bronchus gets clogged with thick, soft mucus. So, in this case, bronchial asthma, Dr. Carey, one of the topmost tissue shoal therapists of the world of ancient times, he suggested that give KP big doses. That is, you can give, in case of, generally we give 3, you can give 5 or 6 tablets in per dose, big doses. For in this situation is depressed, weak asthma patient. Most suitable when tongue is covered with brownish coating. Brownish coating of tongue is calcareous phos characteristics. Sputum comes out in asthma. Characteristic sputum. Characteristic sputum is sputum full of I think some bubbles. Characteristic the characteristic sputum of asthma is sputum with lot of bubbles and sudden pulmonary edema with suffocating collapse from spasmodic capacity. Pulmonary edema, see the pulmons, that is the cells at the end of the lung. Those are fluid accumulated and pulmonary edema is arising. This is a very fatal disease. It causes suffocating collapse. The patient get out of breath, spasmodic cough, and may suddenly die also. During cough, there is profuse watering from eyes, mouth, then use natrium alternately. That is, there is cough, severe cough, and there is watering from mouth and eyes. Then use KP and NM. In last stage of croup is a type of cough. If patient is pale, anemic, and fainted, then use KM alternately. Please remember this situation. Here you used to use NM alternately. Here is KM alternately along with KP. KALI PHOS for respiration continuing. Breathing stress of asthma due to nervous weakness or fatigue, worse from labor or movement. Labor means in the physical labor. Patient release deep sigh involuntarily, groaning and sighing deeply during sleep. KALI PHOS for circulatory system: unsteady slow pulse due to nervous debility, irregular pulse with gap, restlessness, insomnia, sadness, anxiety, nervous debility with palpitations, breathing troubles and palpitation while going upstairs due to nervous and physical weakness. Very common disease. of middle-aged persons and ladies also. For weakness in blood circulation, fainting, dizziness, uneasiness about heart, following severe morning anxiety, emotion, irregular action of heart. This irregular action of heart, ECG. All this thing is covered by KALI PHOS. KALI PHOS for nervous symptoms. KALI PHOS is the chief remedy for paralysis of any type of any part of the body. Exclusively used in paralysis or neuralgic pain when patients very weak and all emanations from body, even expiration, to feel the obnoxious. Please remember this thing before using KALI PHOS. You must be sure that the patient body's emanations, secretions, whatever you call discharges, it must be rather filthy obnoxious. If it is not filthy, not obnoxious, then probably KALI PHOS is not his medicine. They cannot tolerate noise, light, other external stimuli. That is another important point of KALI PHOS. They cannot tolerate any external impressions. Trouble get worse from loneliness, rest, and much exertion, and better from pleasant excitement. Mind this, better from pleasant excitement, but extreme get worse when he is lonely, and he take rest, and much exertion. Rest has also much exertion. Both is adverse, but from light movement he is benefited. Lachrymose with reporting to doctor. Lachrymose when reporting to doctor. Nervous, excited, angry, hysteric without any reasons. Hysteric manifestation. Epileptic patient with sunken face. Palpitation and body cold after attack. Use alternately with chief remedy aim. Calimure is a chief remedy for actually epileptic attack, but you have to use it KALI PHOS and Calimure alternately. Paralysis of children, whatever may be the reason, the first medicine should be KP. The first medicine should be KP3X. Constantly for say 15 days or maybe 1 month, the thing will be arrested. The disease will be arrested. Such an important thing is KALI PHOS. KALI PHOS nervous system continuing. Restless due to intense pain of sciatica. Stiffness of affected area from hip to knee along with back of thigh. For illness or injury when weakness and exhaustion appear from nervous regions, KP is infallible. That is the most important line. When there is illness, injury, anything from weakness, exhaustion or nerve, then KP is infallible. KALI PHOS for skin troubles, eczema where oversensitiveness, nervousness accompanied. Patient is suffering from eczema, that is skin disease, but you note that the patient is oversensitive, very much nervous, then you can consider KALI PHOS. Generally, in case of eczema, we give Calimure and other medicines, important medicines are there. But if you see that oversensitiveness, nervousness is there, then you can consider KP also. When phelon, boils, carbuncles, extremely obnoxious exudate. Extremely obnoxious exudate, I have already mentioned, KALI PHOS is not remedy. Pemphigus malignus. This is pemphigus malignus. This is actually blister blades all over the body, and you can apply here also locally and orally. Alopecia areata also. This is eczema. Both the things are eczema. This is carbuncles. Pemphigus malignus, that is malignant blades and blisters all over the body. Elsewhere, maybe various places. Don't get nervous. Just remember this thing, that this is KALI PHOS situation. Also in alopecia areata. KALI PHOS for skin trouble. Skin dry, wrinkled. Skin dry, wrinkled. When smallpox assume malignancy, skin full of pus, feel deadliest eruptions. You know, smallpox eruptions. Very deadly eruptions, full of pus. In that case, KALI PHOS, keep KALI PHOS. The this pusful eruptions or blebs will be drying gradually. Itching and crawling sensation all over skin, better from light rubbing. Light rubbing, slow movement, these are all KALI PHOS characteristic. They will feel better for this. But itching cause soreness, chafing. If you itch, it will cause soreness, chafing. But if you slow rub, you will get benefit. Itching of thick skin, palm and sole. Itching of sole. Itching and crawling over chilblains. This chilblains that is frostbite, attack from very cold. So if there is itching and crawling, use this chief remedy with Calimure. Give Calimure, KALI PHOS. Say one is you can use this locally and orally also. Like us. Miss Ivy Day, aged 22, as reported by family members, she had been showing hysteric behavior for last few weeks, no sleep for last 4-5 days. Sometimes she used to sit with a grim face, sometimes used to giggle, again frequently used to mutter in delirium. That is some sort of hysteric manifestation is there. When someone asks something, she used to keep staring in the roof above. When whatever food was placed before him, quietly she took a part of it, then placing her hands on both sides of head, she used to sit idle with head down. It was collected that she worked from home for last 8 to 10 months. Used to sit before laptop for 14-16 hours at a stretch, a day at a stretch, sometimes without timely food and bath even. Observed that Miss Day's overall health was okay, but signs of deep tiredness, weariness, firmly attached to her face. Family members reported that washroom got full of filthy smell after she used it. Note the symptom. Washroom got full of filthy smell after she used it. Mother reported that her menstrual emanations were also externally malodorous. Prescribed KALI PHOS 3x 5 times a day for 4 days with 1 TSF of warm water. After 2 days, got a message from Mrs. Day's residence that she slept with loud snoring last night for 12 hours at a stretch, and there was a sea change in her behavior and attitude too from this day. She was further given KP 6x 3 doses a day for 3 days more. See how this, if you look at the problem of the Miss Day, then you may get nervous. How I will address this thing? But there are symptoms. There are symptoms. If you go deeply and watch every minute symptom, you will get the light. This washroom get full of filthy smell after she uses. Mother report that menstrual emanations are extremely malodorous. KP is the case. Thanks for listening and viewing. Any problem, please write down in this comment section. I will certainly respond. Many